All right, today we're going to tackle one of the body's most common, but maybe most misunderstood responses the fever. I mean, we've all had one, right? But what is actually happening inside our bodies when that temperature starts to creep up?
And that brings us to the big question, really. Is a fever the disease itself, or is it actually part of the cure? For so long we've treated fever like it's the bad guy, something you have to get rid of right away. But what if it's not the enemy at all? What if it's a critical part of your body's battle plan? So here's our battle plan for today. We're going to start with the intrusion, then head to the command center. After that, we'll see how the body is mobilizing the troops and talk about why fever can be a double-edged sword. Then we'll get practical with a home-based strategy and finish up with the really important part, knowing when it's time for calling for reinforcements. All right, let's jump right in with section 1. First things first, what even is a fever? Let's get a really clear definition. Okay, so a fever is an increase in body temperature, usually above 100.4 Fahrenheit. But here's the absolute key takeaway, the most important part of this definition. A fever is not the illness. Think of it more like your body's fire alarm. It's a signal, a sign that your immune system has spotted an intruder and is kicking into high gear to fight it off.
So, how does your body actually do that? I mean, how does it intentionally make itself hotter? Well, that decision doesn't happen just anywhere. It's all controlled from a tiny, super smart command center right in your brain.
And that command center is a part of your brain called the hypothalamus. You can think of it as your body's internal thermostat. Day in and day out, its job is to keep everything in balance, especially your temperature, holding it steady right around that sweet spot of 98.6 degrees Fahrenheit. So here's how the chain reaction kicks off. First, intruders show up. We're talking viruses, bacteria, that kind of stuff. Your body's defense cells spot them and release these little chemical messengers called pyrogens. These pyrogens travel all the way up to your brain, knock on the door of the hypothalamus, and basically say, hey, we've got a problem down here. Time to turn up the heat. And just like that, the hypothalamus cranks the thermostat up to a new, higher setting.
Okay, and this is where that super familiar feeling of getting sick comes from the chills. Think about it. Your brain has just set the new target temperature at, let's say, 102 degrees. But your body, it's still hanging out at a normal 98.6. So now there's this gap, right?
Because of that gap, your brain looks at your current 98.6 degrees and thinks, whoa, we're freezing. So it does exactly what it would do if you were stuck outside in the snow. It starts shivering like crazy. All those muscle contractions are designed to generate heat, to try and close that gap and reach the new 102-degree target. It's pretty wild, right? That's why you feel so cold and pile on the blankets, even while your temperature is technically going.
Which brings us to a really big question, a true dilemma. Is fever a friend or a foe? I mean, if it's a natural part of our body's defense, should we be in such a rush to bring it down with medicine? Or are we better off just letting it do its thing?
Well, a lot of experts are now saying that, fever isn't just a side effect of being sick, it's an active part of the immune response. It's a weapon, and if you rush to suppress it, you might actually be getting in the way of your body's own defense system. So it's definitely a double-edged sword. On the friend side, a higher body temperature makes it a really tough place for viruses and bacteria to multiply. It slows them down. Plus, it actually seems to supercharge our own immune cells, making them more effective. But then there's the foe side. Fevers make you feel awful, right? You get fatigued and uncomfortable. And in some cases, especially with little kids, a really high fever can be risky, potentially triggering seizures or just putting a lot of strain on the body. Okay, so let's get practical. How should we actually manage a fever when we're at home? The key here is to shift your mindset. The goal isn't always to stamp out the fever completely, but to make yourself comfortable while your body does the heavy lifting. So it's really all about comfort and support. First up, hydration is absolutely crucial. You lose a lot of fluids when you have a fever, so you got to replace them with water, soup, whatever works. Rest is a big one too. It lets your body focus all its energy on fighting the infection. Simple stuff like wearing light clothing or using a lukewarm compress can also make a huge difference. And of course, you can use over-the-counter meds like acetaminophen or ibuprofen, not necessarily to crush the fever, but just to manage the discomfort so you can actually get some rest. And of course, to manage a fever, you've got to be able to measure it accurately. So knowing how to take your temperature the right way is a really simple but super important skill. It helps you keep tabs on what's going on. All right, now for what is maybe the most important section of this whole explainer, calling for reinforcements. Look, most fevers are totally fine to manage at home,
But sometimes a fever is a red flag for something much more serious, and you need to know when to seek help. And let's be crystal clear about this first one because it's so important. For any baby under 3 months old, a temperature of 100.4 degrees Fahrenheit or higher is an immediate medical emergency. You need to call a doctor or go to the ER right away. Their little immune systems just aren't strong enough yet, and you can't take any chances.
Okay, now for adults, the number you really need to watch for is 103 degrees. If it gets that high, it's time to seek immediate care. And it's not just about how high it gets, but how long it sticks around. Any fever that lasts for more than 3 days is a sign that you need to get it checked out by a doctor.
And please remember, the number on the thermometer is just one piece of the puzzle. You have to look at the other symptoms too. If the fever comes with things like a really stiff neck, or confusion, or chest pain and trouble breathing, or a weird rash, don't wait. Those are all signs that something more serious could be going on, and you need to get emergency help. So we end up right back where we started. Is fever something to be feared, or is it a process to be understood? Hopefully now you see it's not the enemy. It's a powerful signal from your body, a sign that your internal defense systems are working exactly as they should be. And when you understand the battle plan, you can work with your body, not against it.